Welcome to Askimo TV. Talking today to Robb Watt. Robb is an independent addiction psychotherapist specializing in sex addiction. Most recently, he managed the addiction treatment program at the Priory Hospital, Roehampton, and is currently trustee on the board of ATSAC, which is the Association for the Treatment of Sex Addiction and Compulsivity. Hi, Robb. How are you?
Hi, Joan. I'm good, thank you.
Great. Robb, let's talk today about childhood trauma. What is emotional and psychological trauma?
Emotional and psychological trauma is usually a result of extraordinarily stressful events in somebody's early childhood. And it affects and it shatters their sense of security, their sense of safety. So their world becomes an unsafe place by definition, and they feel helpless and vulnerable in what they perceive to be a dangerous world.
What are some common causes and even overlooked causes of emotional and psychological childhood trauma?
Well, I think when we think about trauma with a big T, what we normally think about is physical abuse and sexual abuse, with somebody close to you dying, or a car accident, and of course that's the big T, trauma. But when we talk about childhood trauma, the definition of trauma really changes, and it's much more about the definition of trauma with a little t, if you like, is about anything that's less than nurturing. So it's about a child not getting their needs met, and it's about being growing up in a dysfunctional environment. Now, I need to qualify that by saying that I've never met a functional family yet. I don't think the human condition allows for it. However, things like rejection, anger in the family, low sense of self-worth, violence, obviously, and sexual abuse are right up front. But the overlooked ones, I think we have in society this idea that we need to be, especially men, I suppose, but that we need to be strong and to be able to be independent. Well, this needs to be modeled for us when we're children. So neglect, and that can be just neglect of emotional needs. So that idea, with a little one, not now, I'm too busy. It might seem like a flippant remark, but that needs to be explained through, that it's not about because you're rubbish or because you have no sense of, you have no worth. If that's done enough, then the child will make it up about themselves.
What would be the signs and symptoms of emotional and psychological trauma?
Well, there are physical elements to it that you might there might be insomnia, there might be a struggle with sleep, and that would be a lifelong experience. Getting startled very easily, racing heartbeat, anxiety. What we call somatizing, which is, the physical's response to your emotional landscape. This is very real. This is, how your body reacts to your emotional world. So there's anger, irritability, carrying a lot of shame, fatigue, struggling with concentration, confusion. There's a multitude of consequences.
What happens if trauma is left untreated? How can it manifest itself, and what distorted coping strategies might a person have?
Well, it's usually relational in terms of distorted coping strategies. So, we were talking about as a child, the dysfunction. And what happens in a child's world is when there's something going on and there's dysfunction, and very quickly, when you're very young, your brain isn't developed fully. So you have the old reptilian part of the brain where experiences are stored, and it doesn't have any reasoning, and it can't figure things out. All it is fight or flight. It's either good or bad, or life or death. So when you have an experience as a child, that's where it's stored, and that's why later on in life, once the front part of your brain, where you can make some choices and decisions and reasoning is developed, when some of your childhood material gets triggered, it doesn't make any sense. So something can happen in the middle of the room. There could be half a dozen people, and we'll all have different responses to it because of our learned experiences when we were children. So what can happen is relationally you can develop coping strategies. If you were hurt as a child, for instance, you'll develop strategies that make sure that people don't connect with you. So you might be very angry. Another opposite to that might be if you didn't get your needs met, then you might become overtly sexual. So there might be a sexual addiction that develops. You can manage working in the field of addiction. I see a lot of childhood trauma, and it's not unusual. There's a large percentage, specifically of women, who have sexual abuse in their family of origin history, about 70%. And a coping strategy would be alcoholism, drug addiction, gambling, food is massive as well. So it's distorted ways of managing our emotional landscape.
Just to finish off, what does treatment of childhood emotional and psychological trauma involve?
Well, I think first and foremost, just to highlight that what it has to be is it has to be safe. And there needs to be trust, otherwise nothing's going anywhere. So that's the first part of treatment. It's about developing a safe place and making sure that somebody can take some risks, because this is terrifying. As I described before, this is about, if I go there, I'm going to die. So it needs to be a very measured, professional, clinical, facilitated process. And again, that can be started off by and suggested that it is with a qualified therapist. We go onto a BACP website or a UKCP website where you get qualified therapists. So get into a relationship with a therapist. And then there are programs specifically designed to address this. There's like 5-day non-residential treatment programs. I went out to the States and studied with a lady called Pia Melody, and there's an extension of a codependency program where it gives you an opportunity to figure out what's your stuff and what's not your stuff. When there's childhood trauma, quite often there's a lot of shame and anger that's carried. It's not yours. And what it is, it's about a process. Because if I can just take a moment and give an example, in order for, say, a father to sexually abuse his young daughter, I think we can all agree that that's a shameful act. There is shame within that interaction. In order for that father to perpetrate that act, he needs to be shameless. So you can understand who ends up carrying the shame. It's the little girl. So there's quite often a lot of carried anger and shame, and it's difficult for the patient to figure out what's theirs and what's not, because it's very difficult to blame the parents because there's a sense of loyalty no matter what happened. So it's about a process of very gently identifying what's not theirs, giving it back to the caregiver, supposed caregiver in inverted commas, and then what's left is the material that they can change. It's about a program of change. It's a process of change. What can we about the coping, identifying the coping strategies that are dysfunctional and offering more functional coping strategies where you get your needs met. So in the short, it's about identifying what is it that you're doing that's stopping you getting your needs met. That's a very empowering question to answer.
Thank you, Rob. Thank you so much.
Absolute pleasure.